The UK has become the first country in the world to approve Merck's coronavirus antiviral pill. The drug is intended to be taken twice a day for 5 days by people with mild to moderate COVID-19 symptoms. Preliminary results suggest the treatment cuts hospitalizations and deaths by half among patients with early symptoms. The European Medicines Agency is also trying to accelerate a review to formally green-light it. Well, Europe is hitting record levels of COVID-19 infections and deaths. The World Health Organization says the continent is once again at the center of the pandemic, describing the pace of transmission as of grave concern. The WHO Europe head, Hans Kluge, warned that the region could suffer 500,000 coronavirus-related deaths by February if the current trajectory continues. Well, to talk about these developments, we're joined by Dr. Bharat Pankhania, a senior clinical lecturer at the University of Exeter Medical School. Thanks very much for joining us on the programme again. Let's talk about just briefly the COVID pill first. How does it work and how effective could this be, do you think, in the overall fight against COVID?
So this drug is a nucleoside, and what it does is it interferes with the replication of the virus. So in the presence of this drug in your body, the virus makes mistakes, and as a result of severe serial mistakes, it becomes basically an ineffective virus and therefore dies and peters out.
And what sort of people should be taking it? It's people with mild symptoms.
Yes, this is very important. So people with mild to moderate symptoms, I would like to err on the side of caution and say mild symptoms, because the sooner you take it, this is the key point, the sooner you take it into your infection, the better the outcome. So the MHRA in the UK is licensing it for people with an infection and a coexisting morbidity like diabetes, heart disease, blood pressure. My advice as a clinician would be take it, but take it as soon as possible. For it to work, you've got to take it early.
But the bigger message, of course, presumably is still prevent getting infected and get vaccinated.
Oh, absolutely. So this is not a magic pill. And the best protection possible is be fully immunized, take your boosters, also be fully immunized with the seasonal influenza, and wear your mask. Wear a better quality mask like an FFP2 mask with the Delta variant, which is more infectious. Those preventative measures are in your favor. And then we've got a new additional armamentum, which is this pill.
And just briefly, as we mentioned, the winter outlook not looking good in the UK or the continent. What's your assessment of that?
Well, we've got to take precautionary measures now, and the sooner you take the precautionary measures, the better. So my advice is, if you haven't been immunized, please do so, and you must get your seasonal influenza vaccine in as well. Wear your mask, wear an FFP2 mask now, and reduce your interactions in crowds. We need to suppress the rising number of cases.